Medicare is the federal government health insurance program for people who are 65 and older and younger people living with certain illnesses or disabilities. Today, we're going to talk about the parts of Medicare, when you're eligible, how to sign up, and late penalties you will pay if you don't sign up on time. Here's how it all works. Medicare has 4 parts. You've probably heard of them: Medicare Part A, Part B, Part C, and Part D. There's also Medigap, which is important to know about as well. Here's how they all fit together. Medicare Part A covers inpatient hospital care and related services. Part B covers outpatient medical care and things like doctor's appointments. Part D covers your prescription drugs. And Part C, which I'm mentioning out of order because Part C is Medicare Advantage, which is a bundled alternative to original Medicare, and it's sold by private health insurance companies. It's also important to know about Medigap, which is a supplemental insurance policy you can buy that covers your out-of-pocket costs if you have original Medicare. You usually buy this at the same time you buy Medicare. If you don't, it may be impossible or expensive to get this coverage later. For most people, you qualify for Medicare when you turn 65. Other people qualify for Medicare if they have certain illnesses or conditions, such as end-stage renal disease or Lou Gehrig's disease. If you're receiving Social Security disability benefits, you qualify for Medicare after you've been receiving benefits for 2 years. For most people, Medicare starts at age 65. You should sign up before your 65th birthday during what's known as your initial enrollment period. This is a 7-month period that includes the month you turn 65, plus the 3 months before and after that month. If you sign up before your 65th birthday month, your coverage will start the month you turn 65. If you're receiving Medicare because you have a disability, your start date will depend on your disability situation, and you can find those dates and details at medicare.gov. Signing up for Medicare happens through the Social Security Administration, so you can get started by visiting ssa.gov, or you can visit your local Social Security office or give them a call. If you're already receiving Social Security benefits, depending on how long you've been getting them, you may be enrolled in Medicare automatically. If you're eligible for Medicare because you're living with a disability, you will also be enrolled automatically. The first big choice you have when you sign up for Medicare is whether to go with original Medicare or Medicare Advantage. Original Medicare is managed by the federal government, and each piece is separate. You buy Part A, Part B, and Part D, and potentially a Medigap plan to cover your out-of-pocket costs. You can then see any doctor in the country that accepts Medicare. Medicare Advantage is private insurance that bundles Medicare Part A, Part B, and usually Part D benefits within one plan. Medicare Advantage plans usually offer some coverage for dental, hearing, and vision care, plus extra perks like gym memberships. Medicare Advantage works like most health insurance plans you've probably had before. There's a network of providers, and to have your care covered, you generally have to see in-network doctors. There are pros and cons to both Medicare and Medicare Advantage. If you have original Medicare, you can see any provider in the country that accepts Medicare. You also don't have to deal with any prior authorization or referral requirements. However, the monthly premiums for original Medicare can get pricey, and there's no limit on your out-of-pocket costs. Although if you have a Medigap plan, Medigap can cover a lot of those costs. With Medicare Advantage, the monthly premiums are usually low, and a lot of Medicare Advantage plans are $0, meaning you pay no premium. They also offer extra benefits that original Medicare doesn't cover. But you do have to seek care within their network, which means that if you travel, you may be out of network for everything but emergency care, and you might not be able to see a specialist if they aren't in network, unless you're prepared to pay out of pocket. Out-of-pocket costs can be high if you use a lot of healthcare. Premiums are low, but plans still have deductibles, copays, and coinsurance. There's a limit to how much you can spend each year on these plans, but it can be several $1,000s each year. It's important to know about Medigap and how it fits into the Medicare picture. Medigap is supplemental insurance that covers the gap in original Medicare. That is, the out-of-pocket costs like copays and coinsurance you'll have when you get healthcare. If you have original Medicare and you go to see a doctor, the doctor has a copay. If you have a Medigap plan, your plan might cover that copay instead of you paying out of pocket. You do pay a monthly premium for a Medigap plan. You also can't have Medigap and Medicare Advantage at the same time. Medigap does have an open enrollment period. That's the 6-month period after you have Medicare Part B and you're age 65 or older. During that period, you can buy any Medigap plan sold in your state. They can't deny you coverage, and they can't charge you more than they charge anyone else. After that open enrollment period, if you do develop a health issue, it may be impossible or more expensive to get a Medigap plan. This also makes it complicated if you decide to go with Medicare Advantage, and later you wish to go back to original Medicare, you may not be able to get a Medigap plan at that time. It's really important to sign up for Medicare on time because there are late penalties if you miss your initial enrollment window. If you're late to sign up for Part B or Part D, there are late penalties that can last as long as you have coverage, which could be your lifetime. If you think you might ever need prescription drugs, it's smart to go ahead and sign up for a Part D plan when you sign up for Medicare. There are no late penalties for Medicare Part A unless you have to buy Medicare Part A, but most people get Part A for free. Some people wonder if you can change your Medicare plan after you first signed up, and you can. The fall open enrollment period for Medicare happens every year from October 15th to December 7th. If you have Medicare Advantage, there's Medicare Advantage open enrollment, which is every year from January 1st to March 31st. There are also special enrollment periods if there are life circumstances that apply to you. For instance, you may be able to switch your Medicare plan if you've moved into a skilled nursing facility or you've moved out of the service area of your Medicare Advantage plan. That was a ton of information. If you're feeling overwhelmed and you want to look into more resources, check out the Medicare content on nerdwallet.com, or you can also visit medicare.gov for more information. There are also state health insurance assistance programs, or SHIP programs, in every state that provide free Medicare counseling for people who have questions. You can find yours at shiphelp.org. My name is Kate Ashford. I'm a Medicare writer at NerdWallet. If you liked today's video, please hit like and subscribe.